took out my own IUD. Why, you may ask? Because when I went to go take it out, the doctor's like, yeah, if you want me to take it out, I'm going to have to send it to the lab and it's going to be $350. Like, I don't know. Like, I guess like they like swab it for like cells or something. I don't know. I said, I don't care. I said, I don't, just take it out. Like, why do I have to pay $300 out of pocket for you to send it to a lab to tell me what? Like, that made no sense to me. So I said, okay, it's fine. I'm going to go. And then I went home. I laid on my back with a towel underneath me. I stuck my finger inside of me and I felt the string. So then I very gently grabbed the string. I started to pull it out a little bit. And when it got to like this point, I felt like resistance, and I was like, okay, like it definitely like must be coming out. Mind you, I had this much string like out of like my cervix that I could actually like grab. So once I pulled it out, it was like obviously very slippery. So what I did was, once it was like at this point, I already had this like coming out of my cooch that I grabbed like a tweezer and I just like wrapped it around the tweezer. And once I felt that resistance, I'm like, okay, I'm just gonna do like a little swift, like I'm gonna do like a little swift like pop, and it should just come right out. And I kid you not, it went like this. It was like boop, and it popped right out.
First off, do not recommend this at all, because this could possibly lead to infection, or it could also perforate your cervix. It's crazy in the US that an insurance company would not cover something as simple as taking out an IUD, because not everyone can afford a couple $100s for a medical procedure. And this is the same thing as people who are not able to afford GLP-1s at the pharmacy. They're getting these compounded medications which are not FDA approved, and no one knows what's actually in them. Honestly, sometimes the healthcare in America is really scary.
Dying in America is expensive. So I have terminal cancer, and because of financial situations, I have decided to donate my body to science. I have 3 kids. My oldest is 15, and he understands that it's a money issue, but my youngest 2 do not. And that was a hard conversation to have with them about why they won't have a grave or a funeral when I pass. But funerals cost thousands of dollars. When you donate your body to the local college here, it's like $100 transport fee that I can prepay in advance that covers the transport of my body from wherever I pass to the facility. They then use your body for medical research or like, surgeons learning or whatever. Then they cremate you for free and send your ashes back to a loved one. For me, that's my ex-husband, and we do not have a good co-parenting relationship. So I have to just entrust with the fact that he will give my ashes to our children. And they'll keep my body for 3 to 5 years using it before they send it to him. Is it a good thing that I'm doing to help, students learn? Yeah. But do I wish my kids would have at least a gravestone? Also, yes.
The American healthcare system needs to get the fuck out of here, okay? This is crazy. I just asked for an itemized bill of earlier this month where I was dying and I needed to be hospitalized for 3 days. Bitch, the total of that 3-day service was $83,334.33. For what? For what? Oh my God. And I'm wondering if I get a degree with this service, or walking down an aisle for surviving. You must be out your mind. This is the price of an Ivy League program. Not only was I dysfunctional during half of this stuff, I also didn't ask for half this stuff. Blood must cure cancer with how much they charge me for blood work. You gotta be $6,000. It sounds like I need to be reimbursed for all the stuff y'all took out of my body. Here's the fun part. $10,296. Do you know what that's for? That is for the HB room board semi-private med bed. Who the hell asked for that? I just need my airways open. Mind you, I got back problems. I really got back problems for 3 days in that bed. So make it make sense. I hope Albuterol at home costs like $30. Apparently, in a hospital, it's like $462. I just needed help to open my airways. You would have thought I left with a baby. So moral of the story, it's better to ride it out and talk to Jesus. Because if it's your time to go, it's your time to go. If it's your time to stay, then he's going to make a way.
It's a really funny experience to be an American and be used to our healthcare system here, or be brainwashed that socialized medicine doesn't work at all, and then go to another country and interact with their healthcare system. Because my first experience was when I went to Hong Kong, and I was having chronic strep at this point in time. I get sick. I walk into the nearest equivalent of urgent care. No appointment, no insurance. Wait like an hour, have my appointment. And afterwards, the doctors were telling me, this is gonna be pretty expensive because you don't have insurance. And I was like, lay it on me. I'm ready. I knew this was gonna happen. The bill, medicine included, $150 US. And because I had chronic strep, I went there more than once. The first time I explained that I had chronic strep, and they told me, oh, just the next time you're having the start of symptoms, come in early so we can give you antibiotics early and you don't have to go through the whole shebang of getting sick. And every time I walked in there after that, they were immediately like, oh, we know you. Yeah, we'll give you your antibiotics and you can go on your way. I was so confused. Like, I don't even have to go through the whole, like, our little, like, gaslighting routine. You're not gonna gaslight me. I'm confused. And the third time I came in, they were like, yeah, this is a problem. Do you want us to book you for a tonsillectomy? Do you know how long it took me to be able to qualify for a tonsillectomy in the United States? I had to be chronically ill for 2 years, have like 8 documented cases of strep. Or when I went to Paris, I had to go to the ER for some reason and was telling the doctor, like, listen, I know I have no insurance. I know it's gonna be expensive. It's okay. I'm prepared for this. I'm ready for it. And the doctors looked at me so confused, like, don't you know this is a public hospital? It's free. Maybe just check with the front desk lady on the way out because you're not from Europe. And so I go to the front desk lady and she tells me, oh, just leave. I was baffled. I felt like I was scared to leave. I had to ask her like 3 times, are you I should just go. No credit card info, no insurance, nothing. I felt like I was robbing them, doing something illegal.
So we're in Valencia, Spain, and my wife got sick, and she'd been sick for like 10, 11 days. It's not getting any better. It's just really, really bad cold and flu symptoms. So finally I was like, let's figure out this Spanish healthcare and let's see if we can get you antibiotics or something. Within 20 minutes of deciding that we really need to get a doctor, she has her telemed appointment already scheduled and it started. The cost of this appointment is $29 with no insurance. We don't pay taxes. We don't have the benefit of free healthcare in Spain like a tax-paying citizen would have. But $29 to see a doctor effectively, or a telemed doctor. She talks to the doctor in English. Easy, super easy to understand. She explains what's going on. They ask her some questions. They say, okay, yeah, it sounds like you need antibiotics. They give her a prescription for antibiotics and something else. And the way they give us prescriptions is they send an email that has a couple of QR codes on it. And you take your phone to a pharmacy, which they're on every corner, there's pharmacies here. And all you do is you walk in, you show them the QR code, or the email with the QR codes, they scan it, they turn around, and then they hand you the prescription. There's no name on it, you don't wait, there's no filling the prescription, none of that exists. Total cost for the antibiotics and another, like, medicine to make things run better, right, was $11. So our total cost, 2 hours from, hey, I think we should go to a doctor, medicine in hand, was $40. $40. And that's without insurance. We're paying $1,000 a month for insurance, and it would have cost us more than $40 just for our prescription. Not to mention whatever our part of the copay was for the doctor's appointment. Not to mention however long it would take us to get that appointment. Man, they're doing something right here in Spain, I'll tell you what.
Americans essentially pay for healthcare 3 times over. First, through some of the highest healthcare taxes in the world. Second, by paying a private company for the right to use that system. And finally, through the medical bills and debt that follow them even after insurance kicks in. It's a cycle of payment that doesn't exist anywhere in the world. Hello everyone, my name is Anthony. I am the judge, the jury, and the executioner.
My name is Carla Zimmerman. I just retired in June from 25 years of teaching.
My name is Bartley Armitage. I've been in Eugene, Oregon for most of 45 years. I was a union carpenter for over 30 years and still a member of the Carpenters Union.
Our current premium is $443 a month.
Through the ACA.
Through the ACA, and which is manageable for us, both retirees. However, it's going up to $2,224 a month. We are kind of in shock. That's without the subsidy. With the subsidy, it's manageable for us. We still live paycheck to paycheck, but it's manageable. The Affordable Care Act, we sort of counted on that in the interim period as retirees to sustain our health care. Without the subsidy, we honestly don't know what we're going to do.
Without the subsidy and with that kind of increase, it's like buying another house and trying to pay for two houses at the same time. Yeah, so we don't know what we're going to do exactly. We don't know how we're going to have some health insurance and be able to afford it on a monthly basis.
The thing that gets me the most is that both of us have worked our whole lives. I always had faith that our government would, when we retired.
The government, that our leaders would have a heart and try to find a way to help everyday Americans.
What I would say is this government should be about we the people, not about some.
How many Canadian patients on a waiting list die each year? Do you know?
I don't, sir, but I know that there are 45,000 in America who die waiting because they don't have insurance at all.
Dr. Martin, in your testimony, you note that Canadian doctors exiting the public system for the private sector has had the effect of increasing waiting lists for patients seeking public health care. Why are doctors exiting the public system in Canada?
Thank you for your question, Senator. If I didn't express myself in a way that make myself understood, I apologize. There are no doctors exiting the public system in Canada, and in fact, we see a net influx of physicians from the United States into the Canadian system over the last number of years. What I did say was that the solution to the wait time challenge that we have in Canada, which we do have a difficult time with waits for elective medical procedures, does not lie in moving away from our single payer system towards a multi-payer system. And that's borne out by the experience of Australia. So Australia used to have a single tier system, and in the 1990s moved to a multiple payer system where private insurance was permitted. And what they found was in those areas of Australia where private insurance was being taken up and utilized, waits in the public system became longer.
What do you say to an elected official who goes to Florida and not the Canadian system to have a heart valve replaced?
It's actually interesting because, in fact, the people who are the pioneers of that particular surgery are in Toronto at the Peter Monk Cardiac Centre, just down the street from where I work. So what I say is that sometimes people have a perception, and I believe that actually this is fueled in part by media discourse, that going to where you pay more for something, that necessarily makes it better, but it's not actually borne out by the evidence on outcomes. And what we've found is that actually working within the single payer system, we can reorganize things. You know, I waited more than 30 minutes at the security line to get into this building today. And when I arrived in the lobby, I noticed across the hall that there was a second entry point with no lineup whatsoever. Sometimes it's not actually about the amount of resources that you have, but rather about how you organize people in order to use your queues most effectively. And that's what we're working to do, because we believe that when you try to address wait times, you should do it in a way that benefits everyone, not just people who can afford to pay.
This is what happens if you don't pay your medical bills in America. You basically have 30 days to pay your medical bills, and they will call you and basically harass you every single day to pay your bill. After it's been 60 to 90 days, they will sell your medical bill to a collections agency where your medical bill will start gaining interest. And from there, they will also start harassing and calling you and basically telling you to pay your bill. Depending on how impatient your collections agency is, they can take you to court and sue you, and they can go after your wages, your paychecks, your car, your home, until that medical bill is paid off. It also really depends on the amount too. Like, I don't think they're going to take someone to court for a $100 bill. I know that your medical bills can't affect your credit score, but once they do sell it to a collections agency, that's when it can. However, a lot of people actually don't know this, but you can actually negotiate your bill and by a lot, like half the cost, because at the end of the day, all they want is your money. You can also do this with your collections agency too. You can also do monthly payments too, and as long as you're making monthly payments on your bill, they can't come after you. So you can literally pay $1 a month and they can't come after you. Usually if you don't have insurance, there's usually charities that will help cover your costs. Even the hospital themselves will give you a discount if you don't have insurance. I know there's a lot of people that will say that their medical bill disappeared without paying for it. That's because either the collection agency gave up, the cost of it, like you probably just own like $100 and they're like, it's whatever. Or because they're gonna come after you years later once your bill has gained a lot of interest. So yeah, that's basically what happens if you don't pay your medical bills in America, unfortunately.
I just got my hospital bill. I was in there for 3 days for a leg surgery, and I'm going to read you the itemized charge list. First, semi-private room and bed changes, $12,487. Changes for drugs and IV solutions, $2,222. Medical surgical supplies, $2,918. Clinical laboratory changes, $5,314. Operating room charges, $7,749. Anesthesia services, $2,157. Physical therapy, $874. I literally had no physical therapy. I had surgery and I walked with a nurse when I got out. And I was the one who said I wanted to walk on my own. I literally held some random nurse's arm. Emergency room services, $5,615. Recovery room services, $1,948. For a total of a whopping $41,288. Free that boy.
Hello, my name is Haley Osborne and I live in the Chicagoland area, and I am looking for a doctor who will test me for endometriosis. I don't care how much it costs. I don't care if my insurance is taken by you. I don't care if I go bankrupt. I don't care if I'm not healthy enough for the test. I don't care. Anyone who will do this for me, I will go to you. I will set up the appointment today. If there are any doctors at all in the vicinity who can help me out, I have gone to over 10 doctors over the span of 3 different states, and none of them have taken me seriously enough to schedule a fucking appointment. I don't care if I don't have the money. I don't give a shit. Honestly, I'm already thousands of dollars in debt. Thousands and thousands of dollars in medical debt because I live every single day of my life in pain. And then on my cycle, that pain is like 8 billion times worse. And it's always been that way. And I don't even care if it's not. Just cut me open and flay me like a fish. Write down what you see and then donate my body to science, because whatever is happening inside of me cannot only be just happening to me. So if there are any doctor, I don't give a shit what your denomination is. If you can get me an appointment to get tested for endometriosis, I would be forever indebted to you. Because if I have to continue to live every single day, I don't want to do it in pain. And I just want someone to take me fucking seriously. Thank you.
I have a question for Americans, and I really mean no offense by this, so please don't take this to heart. I'm just genuinely curious, and I've heard a rumor, and I need it answered by a real American who knows the real answers, okay? Is this true that when you call an ambulance, you have to pay at least 10 grand? 10 grand meaning $10,000. Is that true, or is that a rumor? Because how do people survive? How do you get help, especially if you're poor? Say if I literally was to lie on the street and was nearly dead, if someone was to call the ambulance for me, would that cost me $10,000? I've heard it. I don't know if it changes dependent on the state that you're in, maybe, or the kind of healthcare insurance you have. But that's crazy. 10,000 for one trip in the ambulance? Surely not. Like, what if someone called it and I didn't want the ambulance, and then you've just made me have all these bills? Surely that's not acceptable.
It's not a healthcare system. It's an investor profit system. Just think about all the people living with truly terrible sicknesses and trapped in horrible constant pain because they literally cannot afford the medications that would help them. And for anyone watching who is not from the States, let me give you the reality check that still shocks people every single time. In America, after you give birth, you have to pay to hold your own baby. That's not healthcare, that's profit over people. Imagine a lady gets a UTI. She heads to the clinic and the bill starts climbing immediately. $200 for the visit, another $300 just to confirm the diagnosis, and $70 for the prescription. Suddenly, a simple round of antibiotics has cost her $570. Now, keep in mind, you actually have health insurance through your employer. You are already paying $300 every month for that coverage. But here's the kicker. You have to shell out another $4,000 out of your own pocket before that insurance kicks in for a single cent. And even once you hit that massive deductible, they don't just take over the bills. They only start covering 50% of your cost for the rest of the year. It's an absolute scam. My former manager once told me that relying on the government makes you a communist, which is a perfect example of how skewed our perspective on society has become. He never hesitated to call 911 if his house was on fire or his family was in danger. Yet, he draws a hard line at the national healthcare system. I don't understand how we have been conditioned to accept emergency services but view keeping people healthy and alive as a bridge too far. I am honestly trying to understand why there is so much pushback against universal healthcare in the United States. When the risk of a medical crisis destroying a person's life-saving is such a terrifying thought, to me, it feels like a common sense to protect our physical health and financial future. And I'd be more than willing to pay my fair share into a system that ensures everyone is covered. Beyond all the exhausting political drama, it's hard to wrap my head around why we wouldn't want a safety net that provides peace of mind for every citizen. I see it as a vital investment in our collective well-being, yet it remains one of the most divisive issues in the country. Tell me your thoughts in the comment section. So what I usually say is stay alert, stay focused, don't fail for the government, and until the next video, thank you for your attention to this matter.